Lakshmi for the opportunity, and also thank Dr. Shivkumar, Arti, and our friend Dr. Shivaraman sir, and all the members who are here. I came to know that most of you are HR basically, and you continue to meet. It's a very good interactions. In fact, taking clue from you, most of us don't know what is health till it is getting affected. So, அது வரைக்கும் நமக்கு அதை பற்றின ஒரு நாலேஜும் இருக்காது. இது அடிச்ச பிறகுதான் then we'll understand how bad it is, how miserable it is. In fact, we should not go to people like Hari because the way we plan ourselves will minimize the contact with the doctor. See, that is what we call it as a lifestyle modification. See, once each and every one of us follow this, otherwise it becomes simple. See, in fact, health is not a one goal. It is not the institution which we call it as hospital is place where you get the health. See, the health is with us, day-to-day way we live, the way we eat, the way we exercise. This is what is the real health. If you really practice it to the level which is required, you are taken care. In fact, this is the one, now currently the another clue which you have given in the beginning is that IT sector. So it's a growing sector, but what we see is that this is the sector with multiple risk factors together. It is not the one risk factor. They will have all non-communicable disease, obesity, all stress and uneven timings, all abuse, so everything put together. See, this type of multiple risk factors is also difficult to handle, and this difficulty is not only to the individual, it affects the family, it affects the entire economy, and in fact, it will start affecting the industry also. See, when your employees' health is not taken, ultimately is going to be affect your production. So come back, it's a simple way is which we call it as a lifestyle modification. Shivaraman Shah will explain still better way. நீங்க என்ன சாப்பிட்றதை பொறுத்து he can tell you whether we are progressing on the right track. But from my side, it's simple. So what we eat. So in fact, now there are many tools which will calculate your requirement. So உங்களோட BMR எங்களால் calculate பண்ண முடியும். And what is your way, where you are totally sedentary life or you are little active. Based on that, we can very simply calculate your requirement. See, over நாளும் if you are able to match that requirement, you are as it is now. If you want to reduce few kgs, you can plan. If you want to put on weight, you can plan. But what needed is your a focus on what exactly it is. So, உங்களுக்கு 1800 calorie தான் per day வேணா, you can plan like that. See, it is not that you should eat this, you should not eat that. But for each and every product, now the nutritive value is available, the glycemic index is available, correctly plan பண்ணணும். Similar way is your exercise. See, it is not only maintaining your ideal weight. Each and every part of your muscle, nerve, bone should act. See, otherwise, ரெண்டு மட்டும் பண்றதால weight மட்டும் maintain பண்றதால health will not be there. You should put every muscle intact. Just 30 minutes of simple walking alone, if you are every one of us practicing, it's fine. And stress, everyone right from the kid till you die, you are going to have it. You are going to manage and leave it. But how minimally it affects your health is what is needed. எல்லாருக்கும் ப்ரெஷர் இருக்கும், பியர் ப்ரெஷர் இருக்கும், வேலை ப்ரெஷர் இருக்கும். That's going to be there. It's not going to end at any day. But how you can manage the stress is what is the critically important. இது எல்லாம் சேர்த்து தான் what we call it as a lifestyle modification. Now, இப்போ IT செக்டார்ல எடுத்துட்டோம்னா, now you monitor your number of steps. The similar way we can monitor many things. It's an automated. ஒரு ஸ்டேஜில் even in CAT we can measure what is there in your environment. உங்களோட பொல்யூஷன் ரேட்டை மானிட்டர் பண்ண முடியும், உங்களோட வாட்டர் குவாலிட்டியை மானிட்டர் பண்ண முடியும். இப் யூ மானிட்டர் எவ்ரி திங் அண்ட் மானிட்டர் வாட் யூ ஈட் அண்ட் வே யூ பிஹேவியர், திஸ் வில் டேக் கேர் ஆஃப் மோஸ்ட் ஆஃப் யுவர் ப்ராப்ளம். Because this is the big problem which we call technically as a non-communicable disease. All your hypertension, diabetes, which goes for the complications including your stroke, heart attack, whatever you call it, those complications is because of this. One, lifestyle. Second, which he mostly advises that most of the things are not diagnosed till you have a complication. And ஒரு silent phase இருக்கும் எல்லாத்துலயும். See, the idea is that you should be able to pick up those things when it is still silent, when it is still controllable, when it is still manageable. See, இதுக்கு ஒரே வழி என்னன்னா, do an annual health checkup regularly, everyone. Particularly when you are 30 plus, it should be part of your life. இன்னொன்று The similar way hypertension, diabetes பண்ற மாதிரியே, now it is a cancer screening. All 30 plus, do your cervical cancer screening, do your breast screening. இது நமக்கு வராது, it is not in my history, not in my genetics, not in my family எல்லாம் கிடையாது. Now everyone is expect, irrespective of caste, religion, economy, whatever it is, this is the another goal which we need to touch upon. Simple screening, very effective tools are available. If you are doing it, you are able to do what we call it as an early diagnosis. See, the early diagnosis is make a simple measurable things which we can act upon. Second is that it will have a lesser impact, better cure, and also the cost involved in handling it will become less. So simple வாழ்க்கை முறை மாற்றங்கள் and your early diagnosis. This is about non-communicable disease. If you go to other areas which affects us, in the seasonல வந்தா seasonal flu வரும், dengue வரும், malaria வரும். This is all common. See, நம்ம என்ன பண்ணணும்? See, here also is simple. To the extent possible, keep your surroundings clean. See, the dengue mosquito which bites you, it travels only 500 meters. It's not going to come from Velachery to Arumbakam. It's your area. See, the way you keep your surrounding is going to count for it. See, in the 500 meter, நம்மளால முடிஞ்ச அளவுக்கு with you or with your friends or family in the circle, if you are maintaining it, yes, you are free from this particular dengue mosquito. See, definitely you need a bigger role from the society, government, yes, but at least this is what we can contribute to pick it. Second, in the communicable disease, we take treatment by our own. See, the self-treatment, you will not understand again till you get an impact. சிலது நாங்கள் வேணான்னு சொல்லுவோம், அதுதான் தெரியும். See, sometimes we cannot blame the pharmacist also. அவங்க பாட்டு ஓடிசியில் கொடுத்துருவாங்க, not only antibiotic, in fact, antibiotic, we were all talking about day before yesterday on AMR, antimicrobial resistant. See, one of the real cause is your AMR is your OTC drugs. நம்ம விளையாட்டா எடுத்துக்கிறோம், 4 நாள் சாப்பிட வேண்டிய மாத்திரை 2 நாள் சாப்பிட்டுக்கிறோம். But this is what contribute your antimicrobial resistant, the impact which we will see only in the later years to come. என்னாகும், சாதாரண மருந்து மாத்திரையில் சாப்பிட வேண்டியது ஒரு 10 ரூபாயில முடிய வேண்டிய விஷயங்கள், we need to go for the next generation antibiotic which will become too costly, and definitely those third generation antibiotic will be too complicated. It will have its own side effects. So இதெல்லாம் பண்ணனா the simple intervention. So come back here, your surroundings. This will take off your infection. Second, இதிலே நம்மளோட எக்ஸ்பீரியன்ஸ்ல பார்த்தோம்னா, the simple example most of us know your COVID. Those with comorbids are at more risk. Those are old age or more risk. In fact, we carry infection from the community to the household. நம்ம பண்ண வேண்டியது, if you are cold, isolate yourself, put your mask. At least you will not spread infection to your family members. Old age, vulnerables, uncontrolled diabetes, இவங்களுக்கு தான் வந்து they have a more risk of getting infected, more risk of dying also. So this is another simple intervention you can do it. Then 2-3 preventive measures which I highlighted, just considering the time, I will not go beyond the allocated time. Immunization. This is a most cost-effective intervention which we should give it to our child. So இது வந்து சின்ன விஷயம் நம்ம நினைக்கிறோம். This will prevent many big problems. ஒரு 15-16 diseases we can simply prevent it by giving this type of immunization till the child is 1 year old. So இது எக்காரணத்தை கொண்டு மிஸ் பண்ணக்கூடாது. In that time we should do it. This includes vaccination for your pregnant mothers. So இதை பண்ணிட்டு இருந்தோம்னாவே things will happen, and now the science is growing. Over a period of time we will have a vaccine for many problems. Few days before you would have noticed that there is a vaccine for your cancer. So now already for a cervical cancer also there is an HPV vaccination which we need to do it when the adolescence, we call it. We should give it in the adolescence before she is sexually active. So either we can do it. And third is your touch பண்ணவனே ஞாபகம் வருது என்னன்னா, the maternal care. See, every family will have at least 1 or 2 pregnancy in each and every family. See, what is needed is your proper birth planning. ஸோ அந்த ஒரு 10 மாசத்துல ஒரு ப்ராப்பரான ஆன்டிநேட்டல் கேர் கொடுக்கணும். என்ன காம்ப்ளிகேஷன் இருக்கான்றதை we have to identify, and we need to plan where they will get delivered. See, this is the one of the reason at family level, individual level, we fail to plan. அதனால என்ன ஆகும், கடைசி மினிட்ல we'll just rush here and there. We don't know whom to go, where to go. We'll end up all the problem, and this critical golden hour is lost. ஒரே வழி, plan yourself well. See, you have a 10 months time to plan. If you are not planning in this 10 months, I think we are not doing our job. நீங்க எங்க வேணா போங்க, யார்கிட்டனா போங்க, but plan it technically. See, now there's a one more concept for doing it in home. See, I have a different view. See, natural delivery is something different from home delivery. See, as a process, yes, natural delivery is accepted, but at any time, 10 to 15% of the so-called normal deliveries will become complicated. See, we should have a backup. See, if the backup is there, you can try all this. But this is what from the government also we're trying to get, but we need to understand that there's a difference between natural delivery and the home delivery. And finally, the next generation is your adolescence. See, the whatever lifestyle thing which you are talking of should happen at that age. See, இதுக்கப்புறம் நம்மளை திருத்ததெல்லாம் கொஞ்சம் கஷ்டம். If you are able to do it little earlier, the impact is more. The knowledge which we are discussing will transmit to the next generation. That's the most effective. And இதெல்லாம் பண்றதுக்கு கவர்மெண்ட்ல டெஃபினெட்லி we have all the capacity, all the measures. See, இப்போ நமக்கு வசதி இருக்கவங்க you can go for a private insurance or privately you can pay. But government with all institutions, in fact, we are one of the highest number of medical colleges across the country. We are one of the highest number of primary institutions in the country. We have more than 2,000 primary health centers. See, the reach which we call it, which we can reach in government institution within half an hour travel time in any part of the Tamil Nadu, which is not possible in any of the state. So this capacity you have, your role in there may be challenges because of the workload, but that is not an issue. The quality drugs which we give, no one can give. The quality vaccination which we ensure that time which you maintain from the manufacturing side to the rural administration time, no one can monitor. So, எங்களோட அந்த வேக்சின் ஓட டைம் லைன் பார்த்தீங்கன்னா, I have more than 2,600 cold chain points. From the manufacturing site to the vaccination site in the village, with multiple levels of multiple travel, we could able to maintain 2 to 8 degrees centigrade across. நீங்க எப்போனா பார்த்துக்கலாம். And every vial will have a what we call as a VVM to monitor the quality. See, in the mari measures la we have a government, we have a facility, and whatever the so-called high-end treatment, either in cancer or a cardiology or whatever it is there in the system. And in the system, we are the one state where everything is free. There are many states where நீங்க மாத்திரை வாங்கணும்னா போய் காசு கொடுத்து வாங்கணும். But it's the one state we get everything free. Maybe sometimes எல்லாமே ஃப்ரீயா கிடைக்கிறதால தான் we don't understand the value of it. And it is there. இதுக்கு இன்னொரு முறை high end surgery பண்ணணும் அப்படின்னா for those also we have an insurance scheme where most of our population, almost 80% of our population is covered. தாராளமா all the treatment, whether it's the government or private, they can take care. So, உங்களோட ரோல் என்ன? This knowledge should percolated to your industry, to the family, and to the social community. எல்லாத்துக்கும் இப்பெல்லாம் டோல் ஃப்ரீ நம்பர் இருக்கு, எல்லாமே சர்வீஸ் பண்ணலாம். As I said earlier, because of the volume, see, it's not one or two which we handle. So, our vaccination எடுத்துட்டா, I need to do 10 lakhs in a year. இன்னைக்கு MTM program, yesterday our honorable CM was honored. We have a 2 crore non-communicable disease. I have a line list of 95 lakh diabetics, almost 1.2 crore hypertensive. So this is the number which we need to manage. And number of employees getting, I have around 1.5 lakh employees. See, in the Marukumbodu, there may be a challenge in here and there, but you are always there to provide you the service. It's a mandated, you are there. And finally, to conclude, so the knowledge should go to each and everyone. இதுதான் முக்கியம். இந்த knowledge மற்றவங்களும் கொடுங்க. Whatever may be the challenges, we can overcome. And health is the way we live, the way we practice, and the way we do for every day. Thank you very much for the opportunity. Thank you.